Can you see me?
Yes, I can see you.
Okay, perfect. Good morning, sir. My name is Calvin. I'm from Heart Health India Foundation. I'm a coordinator over here.
Okay.
I'm conducting this session today. So I'm estimating it will be about 40-45 minutes. We'll just go through what we are going to do. So first, we'll just start with an introduction of HHIF, and then we can have a self-introduction, sir. Your introduction. I've gone through your brief, your profile and all. And I was actually stunned to see so many papers, so many conferences that you've attended. I myself am a student, and I just graduated from college, and interviewing a very experienced person like you, and feeling really happy and proud. So, and after that, after a brief introduction of yourself, and then we'll move on to the questions that we have prepared and I have shared earlier. So that's the agenda for today. I'll start now.
Sure.
Okay. Uh, yes. Is my screen visible, sir?
Yes.
Okay, perfect. So, Heart Health India Foundation. So, this foundation was started back in 2020, and this is India's first patient-led organization working on cardiovascular diseases. And it was started by Mr. Ram Khandelwal, and he himself is a young heart attack survivor, and his wife Aditi Khandelwal is also a co-founder, and it began as a non-profit patient organization that started out very small. That is just a Facebook group. Now it has been established as a foundation. And what do we basically do? We are three main things. That is first, spread awareness. Second, we have support groups, and third, advocacy. We work with decision makers and healthcare professionals to basically advocate for heart health policies, programs, and initiatives. Okay. So then we have a range of services like support groups, counseling services, educational workshops, so on. And we also have awareness campaigns like we had a marathon for heart health from Heart Health India Foundation in Mumbai. So things like that. We have health screenings, CPR trainings, and so on. So our main founders, that is Ram Khandelwal and Aditi Khandelwal. And we have two partners with us, that is Dr. Virendra Sarwal, who's a cardiologist, and Dr. Johan Christopher, who is also a cardiologist. So that's about Heart Health India Foundation. Over to you, sir.
Thank you very much.
Yes.
So it's a great pleasure to be among you today, and I would like to share my views about whatever queries you have regarding the heart disease, especially sudden heart attack deaths among youngsters in the population nowadays.
Sir, can we have a brief introduction?
So I would just like to tell you all that I am Dr. Deepak Puri. I'm the Senior Director of Cardiovascular and Thoracic Surgery at Max Hospital, Mohali. And before this, I have worked as Additional Director in Fortis Hospital, Mohali. And I was Assistant Professor in PGI Chandigarh. And I'm the founder, chairman of a global trust called Cardiomersion.
Good to know, sir. Yes. So we'll begin with the questions. So the first question, and we have picked out very relevant and trending questions over here. So the topic of today's discussion would be, are young people at risk of heart disease? And when we ran a Google search, we found the most trending topics, and people were really curious to know, why are we seeing an increase in heart diseases among young people over the past couple of years? So how do you look at it? What do you think are the reasons behind that?
Definitely, there has been a steep rise in the young deaths that we have noticed in the last few years. And before that, also, we were aware that the Indians, they get affected by coronary artery disease and heart attacks at a much younger age. So around half of our patients who get a heart attack are younger than 50 years, and almost one fourth of the patient, they are even younger than 40 years. That was before the onset of COVID pandemic. But we have seen that the statistics show that the Indian population, they are affected at least around 15 years earlier than the Western counterparts. But after the onset of COVID, it was noticed that there is a sudden increase, and this is a global increase. And they have shown that there is almost a 29.9% increase in the sudden heart attack deaths after myocardial infarction or heart attacks in the population between the age group of 25 to 44 years. So this is very alarming, and the reasons behind it are mainly because of the increased incidence of clot formation after COVID, because of the inflammatory effects, and there may be frank heart failure, or the patient can also have arrhythmias. So an apparently healthy young individual can suffer from a sudden heart attack. And also the incidence of stress is rising among the youngsters, and their dietary habits are also not very good, and most of the people, they are adopting a sedentary lifestyle. So these all contribute towards the rising incidence of sudden heart attack deaths among youngsters.
Okay, understood, sir. Sir, myself as a young person, I'm 23 years right now. So, what can I actually look for? Because as you said, a sedentary lifestyle. I work from home. I really don't have a very active lifestyle. I order food. So, what are the early signs that, as young individuals, that we can watch out for a heart disease?
So what we emphasize is that even before the onset of signs and symptoms of heart attacks or heart problems, we should have a screening. And we have also devised our own screening performance in which we can screen the individuals for their risk factors. So once we have the screening, then we assess which are the individuals who have a genetic risk factor. So we need to adopt more aggressive methods to control the risk factors for prevention of the onset, and as well as the slowing down of the progression of the disease in these individuals. And then we have to identify the lifestyle risk factors. So smoking is the leading risk factor, which is number one cause of death among preventable risk factors. And this is followed by obesity and alcohol abuse and faulty diet, uh, and then sedentary lifestyle, then lack of adequate night sleep. 7 to 8 hours of night sleep is very much essential for every individual. And also stress management, which is nowadays even the recreation is becoming stressful. So we have to find actually correct ways of getting rid of stress. And addictions are also on the rise. And then we have a new menace, that is the irrational use of supplements, especially at the gyms. So they are promoting supplements which are not good for the health, and they are disproportionately high quantity, and even banned supplements are being freely supplied in the gyms, which is very much dangerous. And also the relationships are becoming more and more fragile, and there's lack of social support for the young individuals because they have high ambitions, but they don't have adequate social support to understand their needs. And at the same times, like once we identify the risk factors, then we screen the individual, and then we find out the BMI, the waist circumference, and everybody should know their numbers. Like they should know their pulse rate, they should know their blood pressure, their fasting blood sugar, their cholesterol levels. And also we need to know the vitamin D levels, because the rising level of patients who have low vitamin D, it increases the risk of having fatal heart attacks. And once the risk factors are identified, you know your numbers, and then we don't have to wait till we have the sign and symptom. We should start controlling them. And if a person has any uh, breathlessness, or any effort intolerance, like a person who was normally doing routine work, and in doing that routine work, if the person starts getting tired or starts getting fatigued, or a person develops palpitation, a person develops angina, some fainting, or sudden loss of consciousness, or dyspepsia. Many people, they confuse heart attack symptoms with dyspepsia, and they keep on treating it as if they are having some acidity and take antacids and all. And then we also, like, if a person develops sweating, cold sweating, or in females, like, they don't have typical symptoms, so they may be feeling generalized weakness or feeling of being unwell, headaches, and similar symptoms which can be confused with other problems. And sometimes even they are referred to the psychiatrist for seeking psychiatric support, but actually they may be the symptoms of some heart disease that is about to make its onset.
Okay, right. So, in that, you said so the first step would be a regular screening. Is that so, sir?
Yes, and that should be under medical supervision, not self screening or Google screening. So it should be under medical supervision, because only a specialist can identify properly your individual needs.
Okay, if you can suggest what would be that regular interval of screening, and from what age should we start screening?
Actually, screening should start from the childhood itself, because that is the primordial prevention. And if we start in the childhood, before the onset of symptoms and before the onset of risk factors, then we can expect a normal lifespan and a normal health span. So once the onset of risk factor is there, then we have to identify them and control them. So usually in the teenage, people start acquiring faulty lifestyle and other risk factors. The genetic risk factor, they are from the birth only. And after that, once you know the risk factors, then you need not to take medical treatment. You can manage them by control of your lifestyle and unconventional methods like stress management, yoga, music therapy, and many other means. Later on, once they cross over to the next stage, that is the stage of early diagnosis, and basic medical management can be started at that time. And once it crosses that, then sometimes with the onset of complications, the person may need intervention. So timely intervention, which is decided by a heart team, which consists of the surgeon and the anesthetist, as well as the cardiologist and the patient's family, the patient himself or herself. Then we decide which is the best form of treatment that will be benefiting the patient to the fullest. And even after interventions, the patient needs a rehabilitation, and he should go back to proper work, and he should be able to do justice to his career also. And later on, has to continue with the preventive measures to prevent the recurrence of the disease. So it is a continuous lifelong journey, not a single process that you just hit the Google and then you start taking care of your own precautions by your own means, and without any medical advice, then suddenly you land up in the emergency someday.
Yeah, okay, okay. That was a very useful piece of advice that you have given. So, sir, how much role can genetics play in this? Like, out of all the patients, about what percent of them had like previous genetic conditions?
Genetics plays a very important role. Like some people, they have a genetic history of risk factors like coronary artery disease, history of heart attacks, history of high blood pressure, diabetes, and obesity, and dyslipidemias, means deranged cholesterol levels. triglyceride levels. And also uh, some people, they have genetic risk factors in which they have like problem in the conduction system of the heart, where the in the ECG you can find there is a prolonged QT interval, and there can be some arrhythmias, or patient may be having cardiomyopathy history in the family, and which can occur later on in the person's own life also. And then some people, they have congenital birth defects right from the day they are born, and that can also be surgically corrected. And then there are people who have coronary anomalies, the arteries supplying the blood to the heart, they may be going through a abnormal pathway where they get pinched when a person does exercise. So all these can lead to sudden death in a person. And also we have seen racial variations, like Indians, they have got a much higher risk factor, Indians and the Africans, once you compare them to Americans and Europeans. And it is seen that Indians, they have a 6 times higher risk of heart attack compared to Chinese. And also Japanese, the risk in Indians is 20 times more compared to Japanese, and it is 4 times more compared to the Americans. So even if we go and settle in Canada or in US, or we settle in Japan, our risk will remain the same. The genetic risk will not change.
Sir, do you think that it can just be the genetic reasons, or do you think Indian lifestyle or dietary habits are the ones behind their heart disease or conditions?
Actually, it is a both the situations, they have a additive effect. Genetically also we are more prone, and our lifestyle is also more deranged. So that is why we are having this heart attacks in young adults at a very alarming rate.
Okay, okay, sir. Sir, you also mentioned that people who go to gym, they take supplements that are even banned. So, what kind of a policy, or how can we enforce this? Because people will still continue to take them because there are certain results that these supplements give them, right? So, how do we tackle this issue?
Actually, I don't agree with you that they have given results. Like, what kind of results are we looking at? Because I have been to invited to many gyms, and I've seen that most of the people who have been gymming there, they are not given any individual plan. Like they are following a general plan. Everybody is like trying to copy each other, and the trainer is also telling them to do things without assessing their individual needs. And so they are not undergoing any medical screening before starting the gymming. And also I examined the people who were gymming, and we found that most of them, they are continuing to have the risk factors in their life. And also most of them, they are not what they call fit, because apparently they may seem to be having building up muscles, but if we calculate their BMI, if we calculate their waist circumference, and if we calculate their stamina or overall physical, mental, and social fitness, they are not up to the mark. So even despite doing gymming for several years, and most of the trainers, they don't know what is the cut down limit. Like if a person is doing a treadmill, at what time he should stop? Because if person does aggressive brisk walking on the treadmill, and if his or her artery cracks at the moment, so he may not die on the treadmill itself, but he may go home, and clot will slowly keep on forming, and he may have a heart attack later on. So so many people may be getting affected because of this. And I think there should be a strict law that before enrolling a person on a gym, they should be screened medically, and those at high risk should be screened more aggressively. And those who want to do more athletic activity, somebody training for say a sports event, or who is a athlete, or who is a cricketer, or who is preparing for a tournament. So those persons should be more aggressively screened, and their limit is different from the limit of a person who's just going to the gym to remain fit. And also, if a person is going there to lose weight, so everybody has to be categorized, and we have to assess the genetic as well as the lifestyle risk factor of the person before we give a plan to the person that what kind of physical activity they should do. And they should be aware about the American Heart Association guidelines also, uh, which are very clear about the amount of activity. Like if a person has to do a brisk walk, for a normal person just 30 minutes of brisk walk 5 days a week is sufficient. But if he's a heart patient, then 40 minutes of brisk walk may be needed. And like it should be total 150 minutes of brisk walk is sufficient for a normal person. And if somebody wants to do some moderately high intensity exercises, then even if they do for 25 minutes 3 days a week, like 75 minutes in a week, they are sufficient for that person. And for the other aggressive exercises and muscle building and all isometric exercises, they can do just 2 days a week. So if they do in excess, that is also going to be harmful.
Yes, yes, understood. Fine. Sir, is maintaining a healthy heart, is it going to be expensive? Being healthy, trying to go on a healthy lifestyle, healthy foods, um, regular activities, um, maintaining your health, going for regular screening. It's going to be slightly expensive. Is that so, or is there any affordable ways to incorporate these things?
It's not at all expensive, because we generally promote that if we have to take preventive measures and if we have to maintain a healthy lifestyle, it is much more cheaper than going for aggressive treatments later on. So as they say, preventive prevention is better than cure. So actually it is very much true for preventing heart attacks. And also, like I would like to say that screening is just a simple method. It doesn't cost you anything. And even like we can screen a person within a short time, and we can identify all the risk factors, and we can counsel, which is not going to cost anything to the person. And also, we don't tell people to go to the gym, because walking in the park, it is much more healthier. The person goes to a gym has more of a sympathetic activity, more adrenaline rush. And if the person goes to a park and walks around in the nature, the person will have more kind of a parasympathetic activity, and the brain will also be relaxed, and physical activity will be also good. So it doesn't cost you anything at all. Similarly, you don't have to take costly supplements. You just have to take a healthy diet. So it is also not going to cost you anything. And there, apart from that, we have like if a person avoids smoking, it will rather cut down on the cost. And if the person doesn't abuse alcohol, doesn't resort to binge drinking, so all this will again cut short the cost. So I think cost is not involved at all in uh, preventing your risk to the heart. And also, we advocate that for youngsters, they should follow a certain kind of guideline in their life, because most important is the time management. Because the work pressure is very much, and most of them, they are just burning themselves out. And the jobs also quite stressful, they are very demanding. The careers also are very demanding, and most of the youngsters, they want to achieve too much at too early age, and they want to earn too much money. So actually all this is going to finish their life at a much younger age. Because as we tell everybody that life is not a race, So faster you run, the earlier you will reach the destination. So we should not burn ourselves out, and happiness should be that goal, and health is the actual wealth. So if we run after wealth blindly, then most of the people, they will be earning money in the first half of their life, and the rest of the life will be spent in trying to maintain your health. So most of the money will be spent on maintaining your health only. So it is of no use. And also we tell them that they should balance their life, as they say that the left, for the right hander, the left sided brain does all the academic and all the skills, and the left side of the brain is actively used for that, and we are more using that part only. And the other hemisphere, the, for a left hander, the right hemisphere, that is for the passions, your kind of hobbies, your achievements, like poems, and whatever, like music or whatever passions you have. So if we don't keep a balance between the two hemispheres, then the person will surely suffer from the health point of view.
Okay, understood, sir. Sir, uh, so how do I'm asking a very personal question. How do you balance your left and right hemisphere? What are your? I understand that you are a surgeon, you're a doctor. I think one of the most stressful jobs I can probably call it. Is that right, sir? How do you
Definitely.
balance it?
Definitely, cardiac surgery is the one of the most stressful professions. But I think if we don't take our profession as a stress, we if we enjoy our work, then part of the stress is gone, and we uh, enjoy the work better, and we give better results also, and we can also de-stress ourselves whenever we get time, by simple means. Like for personally myself, I am fond of music, and I sometimes, from the college days, I was fond of singing. So I have a karaoke at home, and whenever we find time, we just de-stress ourselves by doing some karaoke, and then we do a lot of academic activities, and we do talks, seminars, and conferences, and there we spread awareness. So that is also de-stressing our stressful job. So I take it as a way of venting my stress, and we maintain a balance between the two.
Right, right, sir. Sir, one more personal question. What would be your favorite heart healthy snacks?
Heart healthy snack. So for the
Yes.
heart, vegetables, they are vegetables and fruits, they are the best. So the recommendation is that we should take at least 5 servings of fruits and vegetables every day, which most of the Indians, they are not taking. So anything that has a lot of vegetables is good for me.
Okay, all right, sir. Sir, are there any emerging technologies or treatments that can help young people maintain their heart health? Uh,
Nowadays, people are blindly running after the technologies. Like everybody has a smart watch, and everybody is counting steps and all that. But I don't know, like to some extent it may be helping them, but it's not very accurate. Like if a person goes and walks in the park and then goes by the watch, then usually I prefer to go by the watch and by the distance. That if I walk every day 4 to 5 kilometers, that is good enough for me, because many times you just make a movement and the watch counts the steps, and so it may be giving a false high reading to you that you have done so many steps, and a false sense of satisfaction. But definitely, like I would like to have some medically designed apps which can identify your risk factors, and especially whenever you are going into a danger zone or a red zone, like if you are walking on a treadmill and once you cross your limit, so that time it should give you an alarm, because it should be individualized. You can't have a generalized. Somebody may be able to go up to a like, it depends on your age, on your genetic as well as the lifestyle acquired risk factors. So everybody may not be having the same limit up to which a person can do. So whenever you're doing a physical activity, your limit has to be defined. It should be individualized. So first we feed in your risk factors and then it gives a limit to you. So if we have such kind of apps, definitely they could help the general population. But I think till we have that, uh, everybody should take medical advice, especially from experts who are well versed, because most of the doctors, they may not be well versed with the actual guidelines, because everybody is constrained to their own specialty. So this fitness itself is a specialized field, and unfortunately we don't have specialists in fitness. We have people who are trainers, but they are not having a medical background. So we need some people from the medical background to be actually uh, defining the guidelines and implementing the guidelines.
Okay, understood, sir. Sir, what can be some of the most common misconceptions about heart disease or even treating heart disease?
Uh, when we talk about misconceptions, I think the first question that arises, most of the youngsters, they think that why should I be concerned at all? I'm young, so this is my time to enjoy life. So why should I be bothered? But actually, I would like to convey to them is that to enjoy, you need not put your life at risk. So you should adopt methods that are de-stressing, that are enjoyable for you, but they should not be harming your health. And at the same time, you should be aware that every year, 20.5 million deaths, they occur because of cardiovascular diseases, heart diseases, and these are 1 out of 3 deaths we are occurring because of the heart disease. So nobody is immune. Like, everybody thinks that why should I be bothered? So ultimately, it's affecting every 1 out of 3 person. And we Indians, we are already at a higher risk. And especially after COVID, we should be aware that the youngsters, they are getting sudden heart attacks. So we have to maintain a balance, and we should not be doing excessive physical activity also, and we should not be having a sedentary lifestyle. We should reduce our sitting, because sitting is also becoming a risk factor. So for all youngsters, we have to clear the myth that it will not affect the youngsters. So this is a very big myth which most of the youngsters are having. And also, we should know that we should not live life like a race. We should enjoy, because life is a journey. So every day, every month, every year is important. And once you maintain a balance between your profession and your personal life and your passions, then we will enjoy the journey in a better way.
Okay, sir. Thank you. That was a very, very nice advice that you have given us. So, for the last question, I would like to ask you, what is cardio immersion that you have started in 2011, and what is the impact that it has created?
Actually, I was deeply concerned by young people coming in the middle of the night with heart attacks and without being aware that it can happen to them. And I started this cardio immersion in 2011. So we had a global conference in which 46 speakers came from abroad and 55 from India. And we had a 2-day conference, and there were 400 delegates. So we discussed the various comprehensive management aspects. which should be imparted in an integrated manner. So we brought together all the specialties, and apart from the medical specialties like the paramedical, also like nursing, physiotherapies, dietitians, everybody, they were given sessions, and we discussed the entire spectrum of the management of a heart patient, the healthcare managers, social workers. So everybody was uh, invited so that they can share their opinions, and we should be able to formulate a kind of a comprehensive management protocols. So subsequently, like everybody liked the idea, and then they requested me to continue it in a continuous manner uh, throughout the years. So then, after organizing two conferences in India, we organized the next one in Orlando, in Florida, in 2013. Uh, that we did in collaboration with the University of South Florida, and we organized on the cardiac emergencies. And after that, three times we have organized in Japan, and two times in Singapore, once in Dubai, and every year, like we choose a different destination, so that we want to make this awareness about all the aspects of management of heart diseases uniformly spread across the globe. And we also do projects, and we invite people for doing some research, and we hold conferences, talks, we hold lectures in colleges, universities, for social groups, and for any organization who wants to spread awareness. We do that free of cost. So over the years now, it's almost 14 years we have been doing it, and the response is amazing. We have websites, we have YouTube channel, so we keep on spreading awareness, not only among the doctors, we spread awareness among the general population also, and with a special emphasis on youngsters. And like already your organization is also doing some similar kind of work, so I am also happy that you are doing it. And I think whenever if you feel that we can be of any help to you, we'll be very glad to help you.
Sure, sir. We'll definitely come back to you. We hope that we can also collaborate for some kind of event. We conduct marathons, we conduct campaign, health checkup workshops, CPR trainings, and so on. So we hope that someday we can also collaborate. So I would like to sum up. I would like to say that anyone watching this um, session, what what I've understood is, as a young person at this point, the action that we can take is get a health checkup, that is a screening. First, screening, and then uh, not immediately take actions like join a gym or very stressful exercises. Individualized, supervised, and it should be customized exercises suggested by a medical professional. That's what we need to undertake. And then definitely um, have lots of fruits and vegetables um, included in your daily diet. And definitely, as Dr. Deepak suggested, listen to music, try to relax, try to be happy. So, yeah, this is summing up. This is what we would like to take forward. And one last piece of advice. Um, if you could just give one piece of advice, that would be really life changing. What would that be for youngsters?
For youngsters, I think one best advice I can be is that don't burn yourself out. Enjoy every moment of your life and lead a balanced life.
Okay, thank you, sir. Thank you, sir, for your time. You have spent about 30, 35 minutes with us. I understand you are also having a very busy schedule, but still, thank you for meeting up with us. And I also thank our volunteer from HHI, Manusmita Mishra. She had helped us contact you, and that's how we had a very wonderful chat. Sir, we this video will be available on Facebook. We'll be posting a few reels as well as putting it on YouTube Shorts. So definitely, I'll share the videos once it's on our social media handles also. Thank you, sir.
Thank,
Thank you. Thanks a lot for your
thank you.
time.
Thank you. Thank you.
Uh,